The Ebola virus is spread by direct contact with bodily fluids from people who are already sick. Most experts say the U.S. public health system is up to the challenge of containing Ebola. For a closer look, I'm joined by Eric Talbert, Executive Director of the nonprofit Emergency USA, and April Dembosky, KQED News health reporter. Eric, your organization recently opened up a 22-bed facility for Ebola patients in Sierra Leone. Give us a sense of what went wrong in Africa to enable this thing to spiral out of control the way it has.
Yeah, Scott, the issue was not enough response effectively early on. Something like Ebola spreads as a virus quickly if it's not contaminated, controlled, isolated early on. So in March was the first case coming from Guinea. It spread to Sierra Leone and spread quickly. We set out another warning this is getting out of control in June, and still not enough was done soon enough. And so here we are in September. And we're looking at, from all the data that shows, if we don't significantly have more action on the ground, supporting people, more treatment centers like we've opened, and we're working on opening another 90-bed center by the end of the month to treat more people, as well as a need for a continuum of care, this thing will continue to escalate.
So it's fair to say then that the best thing we can do, or the most important thing we can do to protect Americans, is to help make sure that things get under control in Africa? Is that fair to say? That's
fair to say. That this is part of what we're seeing, within Dallas with the gentleman who came from Liberia, is really need to support the efforts that are happening in West African region, Guinea, Sierra Leone, and Liberia, because this is where it continues to escalate, and where we see through our hospital in Sierra Leone and now through our Ebola treatment center, it's just continuing to be a major issue, and there's a lot of challenges that make it difficult.
Every crisis, whether it's an earthquake or some kind of an epidemic, it kind of highlights the shortcomings, the strengths and the weaknesses, really, in government structures. We saw that with the Napa earthquake a few weeks ago when water mains broke, hampering firefighters. April, what do public health experts say are the potential weak links in this system of containing something like this?
Well, I think first of all, it's important to note that the public health system in the U.S. is very different from Africa. We have a lot of isolation units, we have hospitals, we have public health teams that can track down diseases, and so it's really different. There's also a lot of cultural differences. The public trust of authorities in Africa is very low, and we have much more ongoing, robust communication in the U.S. Now, in terms of weak links, right now the guidance is all top down. Everything is getting set by the CDC. Those guidelines then get communicated to state departments of public health, and then they communicate those messages and guidelines to local departments of public health and hospitals. And at the hospital level, it's then up to the hospital to provide that training. And that's the weak link, I think, perhaps, based on the reports that we saw in Texas.
And Eric, in that regard, Dallas, we saw some problems there, didn't we, in terms of how local officials there on the ground reacted to this man showing up?
Yeah, the fact that he was released and allowed to go home after he said I was in Liberia, well, it's speculated that he said I was in Liberia, which everybody, it's deeply contaminated area, and he was, from my understanding, knew to go to the hospital report and that he was vomiting, which is one of the telltale signs of Ebola, then was sent home, was a major flaw in the plan.
There can be a lot of politics in these kinds of things. We're in an election season. A Republican in North Carolina calling for a travel ban from West African countries. Today, Senators Barbara Boxer, Dianne Feinstein sent a letter to hospitals urging them to make sure they're on top of this. Is what we've seen so far, is it cause for concern, or does it give you confidence in the system? Either one of you.
I think overall, confidence is in order. I think it's fair that it's very early on for systems to be learning from mistakes, and I think the mistake that we saw in Texas from the nurses turning the person away, one thing that's been brought to the attention, the nurses union has been saying they've done surveys of their members across the United States. They didn't break it out regionally, but about 80% of nurses said they didn't feel like they had been sufficiently trained or educated on how to screen for or deal with Ebola. And I think training systems probably deserve to be looked at, and that confidence level is important too.
And Eric, what about airports? I mean, we saw this, obviously that's a key place that people with the virus, with the disease, could be coming into the country. Are customs agents being trained? Should they be, do you think? I mean, is anybody at the airport, these airports, SFO, any of them, being told, to be on the lookout for something, or is that premature and maybe not helpful?
I think it would be helpful in the sense of if we know, right, we got to be careful here on who we're potentially policing from a health standpoint. But if we know, there's people who are a flight, for example, coming from Liberia or Sierra Leone, there's a very easy protocol that could be put into place with healthcare providers, professionals, to take people's temperatures, check in with them, just to remind them of the symptoms and potentially where to go. Right? So if you showed up in San Francisco from Sierra Leone, where would you go? Would you go to SF General? Would you go to UCSF? Just this case, they feel like they might be having some of the symptoms. So I think that could be done.
It's interesting that right now the director of the CDC has not recommended any kind of screening in the U.S. for airports. I think he's basically said the cost and the energy that would be required to do that won't really pay off, and San Francisco in particular actually doesn't have direct flights to the continent of Africa, and so that's one reason they think we're okay with what we have in place.
And just quickly, the CDC, the White House all saying, hey, we got this, no problem, we're going to stop Ebola in its tracks. Do you think that confidence is misplaced, or is it, is that the right message?
I think it's the right message, in that one of the key indicators we can keep an eye on is like, how do we know we're on the right path? Is in order for this to be able to be contained, one of the key indicators we're looking at is being able to provide treatment to 70% of the people who are infected. And so we're just looking at Sierra Leone. We can look at Liberia, obviously, where the U.S. is heavily involved, as well as Guinea. But within Sierra Leone, it's estimated, of course, there's a lot to be discussed and debated about the numbers and how they're being tracked and stuff, but we can roughly say we think about 25% of the people who are infected are currently being treated. And we need to get to 70% before we can say that this is a significant impact.
Really quickly.
I think there's also confidence to keep in mind if there is a weak link at a local level, maybe they don't have enough staff. President Obama has already vowed to Texas that they would kick in whatever kind of federal dollars that were needed. So.
All right. Well, certainly a lot of people keeping a very close eye on this, not the least of whom are the media. April Dembosky, Eric Talbert, thank you so much.
Thanks, Scott.
Thank you.